Welcome to the Functional and Integrative Medicine Podcast. This podcast is all about exploring root cause medicine, showcasing the power of this approach, and inspiring other medical providers to follow this incredible path. I'm your host, Ginger Allen, and founder of Your Medical Liaison, a medical marketing agency working with medical providers since 2012. My passion for root cause medicine and provider advocacy drives me to help medical providers who have incorporated functional and integrative medicine into their practices. So let's dive in. Excited to welcome Dr. Jeffrey Hockings, who is a globally recognized natural health expert and the founder and CEO of Diabetes Reversal Group based in Dallas, Texas. Known as the #1 diabetes reversal doctor, Dr. Hockings has dedicated the last 34 years to helping patients reverse chronic conditions like type 2 diabetes and heart disease without medication or surgery. A board-certified doctor of chiropractic and graduate of Life University, Dr. Hockings has worked with over 70,000 patients and delivered more than 430 seminars across 6 countries, including the US, Canada, Australia, New Zealand, the UK, and Dubai. He's also the author of 2 impactful books, Imagine Living Without Type 2 Diabetes and Send Your Doctor Packing, and spent 7 years on television educating the public on natural paths to wellness. Dr. Hockings is the inventor of the only patented system in the world proven to reverse type 2 diabetes, and he's currently ranked #1 out of 500 doctors in Dallas on ratemds.com. His extensive postdoctoral training spans functional endocrinology, clinical nutrition, neurology, toxicology, and much more, reflecting his deep understanding of the body's interconnected systems and root cause healing. While he no longer practices chiropractic medicine in Texas, his focus today is on delivering transformative care through advanced functional protocols for metabolic health. Off the clock, Dr. Hockings enjoys golfing, martial arts, hiking, skiing, and traveling with his wife, Tracy, and their daughter, Tiffany. His mission is simple: help people reclaim their health, their energy, and their lives naturally. Welcome to the show.
Hey, great. Thanks for that nice opening, and glad to be here.
So excited to have you. I haven't had anyone on the show yet that specializes in diabetes, so this is super cool. You know, the show is designed for practitioners like yourself that are looking to, learn more about, incorporating these techniques and practices into their practices. So we appreciate you taking the time to share your knowledge with other providers today. Thank you, Doc.
Yeah.
All right. So we are going to dive in here. Can you share your kind of professional journey? Like, how did you get into the functional and integrative medicine stuff? Give us kind of a brief overview. We mentioned in the bio, you went through the traditional chiropractic route, but tell us how you ended up here.
Yeah, well, I mean, my wife and I, for the first 18 years of my career, we built and sold 4 clinics in Southern California, typical pain management wellness centers, under chiropractic. And just quite honestly, kind of got tired of that whole game. So we decided to tackle something even more impactful, which is type 2 diabetes, because it runs in our family. I had an aunt who died of it. My wife's dad, 16 years ago, was really bad type 2 diabetic. And he actually just passed away a couple of years ago from it. Unfortunately, he was one of the guys that didn't want to change his lifestyle. So it was this personal mission for us. That's why we decided to dedicate the second half of our careers to really tackling this, because when we looked around 16 years ago, there was no program somebody could join as a diabetic that showed people exactly what they can eat and not eat with no BS, what supplements to take, what exercise to do, and provide coaching and training all the way through it. So we just created it. And it's been a 16-year journey, and we're telemedicine now, and we got our patent approval 5 years ago, and we're expanding to India. So it's really going bananas now, which is really exciting because we're helping a lot more people.
I love it. I love it. And I can tell you're passionate about it. And I think when it's personal, right? When it hits personal, it just takes on a different dynamic. So I love that you shared that story. Thank you. Let's dive into the medicine. So what are some of the most common root causes that you're seeing in your patient population, and how do you address them?
Yeah, well, again, the biggest thing with type 2 diabetes is it's a 100% reversible condition. It's caused by lifestyle and behavioral bad things, basically, right? Eating the wrong foods, sitting on your butt 18 hours a day, not exercising, a lot of sugar, a lot of soda. And so when you do that for 20, 30, 40 years, eventually your body becomes insulin resistant because you're bombarding your body with so much glucose from all the bad sources. Your pancreas has to keep on shooting out so much insulin to try and bring that blood sugar down that your body literally almost, it's like an autoimmune disease where your body becomes resistant to its own insulin. So instead of the insulin being able to take the sugar out of the bloodstream into the cell to be used as energy, that door to the cell is shut. Now that blood sugar hangs out in the bloodstream, and boom, now you become a diabetic. So that's how it happens. But the good news is you can reverse that whole process when you change the bad behavior and change the wrong lifestyle.
Understood. And I think that that's pretty much even understood by us laymen's. But let's dive into the medicine a little bit deeper, because this podcast is for other providers, right? So we want to educate other providers on your protocols, the things that you're working with, the labs that you're doing, the diagnostic tools. Are they different than others? So can you dive into a little bit more, if you don't mind, of some of the things that our docs should be looking for other than what you just mentioned, and also some of the protocols that you're recommending?
Yeah, so I'll start off with what we got patented, right? Was the specific list of foods you can eat and not eat. So that's the first part of the patent. And then it's also the ingredients and dosages of our nutritional supplements. And we have 87 different nutrients in our supplement formulation. So it's not just a little bottle with chromium and cinnamon and berberine, it's like a lot more robust than that. So as far as the eating part of it, it's kind of, if you look at a diet it's closest to a paleo type diet.
Okay.
All the grains have to be eliminated. So all the bread, pasta, rice, cereals, oats, grain, all that stuff's gone, right? And all dairy products have to go away. So those are the two biggest categories. And then obviously any kind of sugar, dessert. But also artificial sweeteners and then caffeine. So those are some of the biggest things that people have to avoid.
Okay.
So they can have fruits, they can have vegetables, they can have any kind of meat, including seafood. They can have eggs, nuts and seeds and beans. That's all okay on our protocol. So that's the eating part of it. So that's the biggest part that they have to do. And the biggest other thing is that it's not a diet. And that's a big misconception. Even the functional medicine space, a lot of people think, if we just have that patient lose 50 pounds, all their problems are solved. And it's not the case. Because we've got people that are 100 pounds overweight that will lose 50 pounds in our program. So they're still 50 pounds overweight, but now the diabetes is reversed. Right. So, that would be still benefit if they lost that extra 50 pounds, but it's not just a skinny or fat disease. We've had people lose 70 pounds and they're still a type 2 diabetic. So, it's not a fat skinny thing. It's all about that insulin resistance. Now, typically type 2 diabetics have to lose a little bit of weight, but we're very clear with what we do is that we're not competing with weight loss companies. This is not a weight loss program. Right. It is a diabetes reversal program with the goal of reversing insulin resistance. And the weight loss they achieve is just an added benefit to doing our program. It's not the main goal. If weight loss reversed diabetes, you'd see Jenny Craig, Weight Watchers, Nutrisystem, Doom. Everybody would sing, hey, come to our program. It's going to reverse your diabetes, right? So they even know that just losing weight is not the answer to reversing diabetes. So that's one of the biggest categories there. So
let's dive into the medicine a little deeper, only because, again, I'm a layman. I want to understand a lot of this, but I really like to bring value to our providers. And of course, we're going to talk about how they can reach you, how they can become a part of your program, how they can, offer this program to their patients at the end of this segment. Let's dive in a little bit. Let's talk about GLP-1s and, what's going on with that and how does that interface with your program? And do you believe in it? Do you not believe in it? Let's talk about that a little bit.
Yeah, 100% against any of the GOP nonsense going on up there. I've been around 35 years in this space, and whether it's GLP-1s, which is like the flavor of the month right now, right? Everyone's on GLP-1s. It's the greatest thing since sliced bread. See, I'm old enough to remember back in the 90s when fen was the flavor of the month.
For weight loss, I have to say a lot of my girlfriends are on it. It works great, but it's not necessarily for diabetes, but I thought it was a diabetes medication. So educate me a little bit on this.
Okay, well, just so you know, right, the GLP-1s, which under the brand name of Ozempic, was approved back in 2014, I think, by the FDA as a diabetic medication. Wasn't weight loss. Okay. But then once people started taking it, all of a sudden, we're seeing people also lose weight. So they went back to the FDA about 5 years later and got it approved as a weight loss medication under the banner of Wegovy. So there's Ozempic and Wegovy. Ozempic's for diabetes, Wegovy's for weight loss. But guess what? It's still a GLP-1. The only difference is Wegovy is twice the dosage of Ozempic. That's it. Same medication, just branded differently. But now it's kind of skewed the last year where you almost never hear about it now for diabetes anymore. Now it's all of a sudden just this weight loss thing. So it's very interesting how it's kind of evolved over the last 5 or 6 years. But now, okay, so as you know, people, yeah, they lose a lot of weight easily on GLP-1s, but guess what happens when you stop taking the GLP-1? The weight comes back, right?
Sure.
So it's not a long-term solution. And that medication was never designed to take it every day the rest of your life. And that's the problem right now is people are doing that. Now there's side effects happening, intestinal issues and yada, yada. So yeah, I'm a big believer that Ozempic and any of these GLP-1s, it's not a thing that we ever recommend. We're trying to get people off of that because whether it's, again, Ozempic, whether it's insulin, whether it's metformin, any kind of diabetic med, it's all just a shortcut that's bringing that blood sugar down artificially and not solving the problem. That's the issue.
We're not addressing the root cause, Dr. Hockings, right?
Amen.
Let's say you got somebody comes in, they're 350. I mean, they are like, on death's door, it's either, GLP-1 or it's bypass surgery. How do you deal with that kind of patient when they're at that level that they're at death's door?
Yeah. Again, they don't have to take that. That's the whole point. If somebody is taking that, see, they won't come to us looking for that solution. That's the point. They will go to their doctor if they're that desperate to lose weight. They'll go to their doctor and get on some GLP-1s and get the weight down pretty quickly. Great.
Okay.
But when they come to us, they're coming to us because they want to reverse their diabetes, not because they want to lose weight. So we've got, oh my gosh, we got tons of people coming that are currently on GLP-1s. But once they go through our program, the 3 to 7 month program we recommend, they get off of all of that.
They don't need it. Okay.
They don't need it anymore. So we're basically the off ramp for the GLP-1s if someone's taking it. But we certainly don't recommend it for people. That's for sure. If they're taking it, hey, just like you're taking insulin, whatever else, the goal is how do we get you off of that as fast as we can?
Fantastic.
Yeah.
Can you share a story about a patient? I know you've had 70,000 people that you've helped over 34 years, but one that sticks out maybe in recent memory, or one that maybe even that just sticks out in your memory for a lifetime, that's life was significantly improved using your protocol?
Yeah, I'll give you 2 quick ones. One that'll kind of relate to what you just said about someone coming in that's really overweight. I had a patient about 15 years ago come in that was literally about 420 pounds. A big guy. He was like 6'6", just a big individual, right? Now here's the thing, his A1C was 14, and get this, he was taking 300 units of insulin every day. And his A1C was still 14.
My God.
So that's where you talk about insulin resistant. Not only was he resistant to his own insulin, he was now resistant to the artificial insulin because the doctor's like, I can't put you on 500 units of insulin. So the doctor's like, I don't know what to do with you. So he came into us, put him on our 7-month program. He lost 150 pounds in our program, eating the right way, etc. Got off of all of his insulin and got his A1C under 6.0 within 7 months. Wow. And that was one of those examples, Ginger, where like I always look at them like, I sometimes I even doubt, like, am I going to be able to help this person because they're so messed up, right? Sure. And that was a perfect example right there of I never, ever again doubt the body's ability to heal when you stop doing the bad things to it. That was a perfect example of that. So that was really cool. And then just recently with a lady, like we were just on the Dr. Phil show last month on December 15th.
Oh, congrats.
Which was awesome. And one of our patients was on there who went through the program, Darlene, and she was a really, really good example. She lost about 30 pounds, but when she came to us, she had neuropathy in her feet, had a stomach ulcer, and high blood pressure. And after 5 months in the program, ulcer went away, neuropathy went away, got off all the medications, A1C was normal. So those are things we just see that every single day. It's just so common, right? I'm taking this many meds, I come in, I got symptoms. Now at the end of it, they're off all the meds, symptoms are gone. So that's what's exciting about this, where we're still fired up about doing this after all this time.
That is awesome. Oh my gosh. Yeah, no, that's great. So you've been doing this, functional medicine thing a long time, but if you could tell us kind of what some of the challenges that you face providing this functional type medicine, this podcast was really designed for physicians to, support other physicians on, doing these type of practices. So what are some of the challenges you faced in this business model?
Well, I mean, I'm going to say the biggest one is that most medical physicians have no clue that diabetes is reversible. And, and it's not their fault because they're not trained it's reversible in med school. Like we've got 2 board certified medical physicians on our team, and they'll be the first ones to admit it that, yeah, we weren't trained how to reverse in med school. They had to learn it outside of the med school, taking functional medicine training to learn how to do that. That's the biggest thing, is that most doctors have no idea. So there's a little bit of resistance, like, that's not good. It's hocus pocus, whatever. So that's a little bit challenging. And of course, that dovetails into now the patients. 99% of diabetics don't know it's reversible because their doctor doesn't tell them it is. Right. So again, I'm not blaming the doctor. They're just doing what they're trained to do, right? Which is manage the disease with medications. So just getting over that hurdle. That's why we have to go direct to consumer and go right to the diabetic and say, hey, this is reversible. We've got the proof. We got the patent, the study, all the testimonials. And so that's kind of gets them into it. Then their doctor, even if their doctor is sort of skeptical initially, once they see the blood sugar start coming down, we make that doctor a convert, like, wow, like, what are you doing? Because I've never seen this before. So that's really cool when that happens, when it opens the eyes of the doctors who were initially skeptical.
Yeah. Yeah. I would think, connecting with, primary care providers that are having challenging patients that they just can't get it under control would be a great referral source for you. So if you're a primary care provider and you need help for your diabetic patients, please refer them to Dr. Hockings. He's virtual, so he can take care of your patients from anywhere. I'm assuming you're pretty much available in all 50 states.
Well, here's the thing. When doctors right now, instead of, they don't really refer people to us, they can actually become a licensee of ours.
Oh, good.
So then they can actually offer this service in their practice, and we kind of train them how to do all that. And they become a legal licensee of ours. We kind of work with them that way.
Great.
They're not referring people to us. They become an actual licensee. It's very, very simple. And that's not just medical physicians, right? You can be a chiropractor, an optometrist, a dentist, podiatrist, med spa owner, audiologist, pharmacist. Like, any of them can actually become a licensee of our program. So we're rolling that out this year, which makes it really easy.
Oh, fantastic. So any medical provider. Okay, great. And we'll get more information on that in a little bit. Yep. So what strategies have helped you build a successful practice, either from a clinical or a business perspective? How do you think?
Well, it's interesting.
You've been very successful. So, we'd love to have successful doctors on the show to show other doctors it is possible.
Well, it's been a real crazy journey for us, Ginger. Like the last 16 years that we've been doing this specifically, like the first 9 years, as you mentioned, that's when I did all these different seminars all over the world. That was proving our concept. I would do a seminar every week in a different city. So that's not a scalable model, right? Because I'm only one guy. I can't kill myself, unfortunately. So once we did that for 9 years and we cracked the code on reversing type 2, that's when we applied for our patent back in 2017. And we said, okay, I can't do seminars anymore. Let's start opening up clinics. So then in 2018 and 19, we opened up 17 brick and mortar clinics all over the United States with leases signed on 13 more locations. And then what happened in 2020? COVID hit. We were forced to shut down all of our clinics because we weren't considered essential, if you can believe that.
Oh, no.
That put a kibosh on that. So then we pivoted to our current telemedicine platform. So now we're COVID proof. Now anybody can reach us, online, and we have our telemedicine platform where there's no clinics. But now that we're going to be rolling out this licensing program, now we can actually be in thousands of these clinics around the country without us having to own them.
Right.
We just partner with that physician or chiropractor, dentist, et cetera, because they've all got their own brick and mortar facilities all across the U.S. So that's how we're doing it now, which has been great. Now, it really hurt having to do all that work and have to shut the clinics down.
I was going to say, your pain there, that must have been heartbreaking for you and your wife. Oh, my God.
It was a lot of work and for the 2 years and then to just shut it all down. But again, we did the clinics because we had previously built and sold 4 clinics, so we knew that model. That's why we did that.
Yeah, right. It should have worked had COVID not happened.
Exactly. Who knew there was going to be a once-in-a-lifetime pandemic, right? So anyway, so here we are. So now we're telemedicine. And so that's one of the things I learned is, like, if you want to really grow your company, how do you do it where it's not dependent upon you? Because if you're only one doctor, you can only see so many patients in a day, right?
Right.
So the only way to grow that is to actually either raise your prices or hire associates that can now, in a sense, clone you to where now you'll be able to see more people because now there's more doctors offering services or more locations. So that's kind of the way to scale, I think, any kind of a healthcare practice now. And I learned that a long time ago too, is bring on associates, and then you kind of can step out and just kind of sort of manage your team. And now you just start, stacking, your ability to see more people and help more people, which is great.
Agreed. Yeah. Bringing on mid-levels and all of that. So you are So this program is available to any provider, any medical type provider in all 50 states?
Yes. Yeah. They can all become licensees of our program. Yes.
Okay. We're definitely gonna talk about that a little bit more in a minute. So what advice would you offer to other providers that are just beginning their journey into functional and integrative medicine?
Well, yeah, the first thing is being open-minded to it, because if you're not trained in that in school, you can almost have like that's kind of hocus pocus, all that stuff, it's not scientific, and some of that nonsense, some of those cliches that are out there. So be open-minded to it, and it's just, it becomes common sense physiology when you know the body. And most people watching this do. You eat the right foods, you're going to get healthier. I mean, it's just common sense, right? Garbage in, garbage out. And again, you exercise more, you're going to be in better shape. If you eat right foods, you're going to be in better shape. So I don't think it's a mystery, even for a diabetic. Like, yeah, is soda really good for me or not? Like, really? I mean, you got to be living on a rock if you think that eating chocolate, sugar, ice cream, and soda is good for you.
Right.
But from a functional medicine standpoint, having kind of food as medicine, that's become kind of a moniker here too the last couple of years, where you eat the right foods and eliminate some of the bad stuff. It's just amazing how your body can respond and heal. And it happens fast. Like, we're talking within the first 7 days, you can see dramatic results in blood sugar coming down, blood pressure coming down, sleeping better, digestion better, all by what you're eating. So I want to make sure everybody knows, like, keep an open mind as you're going on that functional medicine journey, because it's phenomenal, some of the stuff that's happening.
I know it's so exciting, because when I meet with these providers, whether they're chiros or MDs, it's the MDs are the funniest, because they're the ones that have, like, a lot of them 20, 30 years experience being an MD. And they're the ones that tell me that functional medicine is way more scientific.
Yeah. Interesting.
And I'm like, that is so cool to hear, because you're right. There is that misnomer out there that this is not scientific. No, we're here to announce again, guys, functional integrative medicine is much more scientific than traditional medicine, or we call it Western medicine.
For these medical physicians, we're not saying like discount everything you've been trained on.
Of course not.
Because if you have 100 patients in front of you, you might only have 20, 30% of them who are willing to change their lifestyle using the functional medicine methodologies. The other 70%, they're going to want to take the meds because they don't want to change their lifestyle. So it's good to be able to offer them both, because all are going to want to do the natural way. So.
And there's a lid for every pot, right? Like my Dr. Billstrom, who specializes in autoimmune medicine, who kind of got me started in the functional and integrative. He's an MD, but he specializes in autoimmune, and he will never prescribe an immune suppressant. So if somebody is going to demand that, then there's another doctor for them. It's not Dr. Billstrom, and that's okay. That's okay, right? I mean, a lot of doctors I see are doing the hybrid model, where they will do some medications, but there are some medications that these functional medicine MDs, chiros, whatever, will not prescribe. They just won't do it, because the side effect of the side effects of those medications are so bad that they're going to cause so many other issues. They just rule them out. So you're right. I mean, I always say, you guys, the providers that are trained in the traditional Western medicine, who have gone back and done the extra training in functional and integrative, you're like the Ferraris of medicine, right? Because you've got the best of both worlds.
Yes.
You've got all the stuff that, that you need for the acute stuff, right? If you cut off your arm, you got to go to a emergency room, right? And you got to get that fixed. So there's definitely always going to be a need for those guys, but this is just the next level, I think.
Yeah, absolutely.
Bringing it to the next level. So I'm so excited. What trends in functional and integrative medicine are you most excited about? I know you specialize in diabetes, but is there anything that's on the horizon that you're like, I might incorporate this into my protocol, whether it be the peptides or the red lights, or is any of that of interest to you?
For us, no. I mean, I'm just like, we're kind of boring. We are literally, all we do is type 2 diabetes reversal. We don't do heart disease. We don't do pre-diabetes. We don't do management. We don't do type 1. We kind of stay in our lane. So I'm kind of boring in that way. That's all we do. And because we have our patented protocol, our whole job now is how do we get this in front of millions of people, because we have the solution for that. We don't want to try and be like the master of everything. We like to be like, hey, this is our niche. Nobody else touches this. We're the best in the world at this. And if you want something else, go somewhere else. I think a lot of people can get too watered down, offering too many. Yeah.
I was thinking of my mitochondriac sister who, I hear her in my ear saying, don't forget to mention to Dr. Hockings and mitochondrial health and how important getting early morning sun is to help boost your fat burning stuff. But, again, there's so much cool stuff out there now. But I love that you're staying in your lane because you're right. You can't be everything to everybody. You can't, and the fact that you have a patented program. So let's talk about that. So you've got the patented program. The doctors can go to your website. Walk us through how a provider would get hooked up with you to do this.
So to become a licensee, it's very simple. We each have a website they can go to learn more about it. It's drglicensee.com. So it's DRG, the 3 letters, and then licensee.com. There'll be the information there to go to kind of watch a short little things like 18-minute kind of webinar video that explains how they can enroll. Very simple, very easy. And the cool thing is when they become a licensee, there's no additional staff they need. There's no equipment to purchase. There's no inventory to purchase. There's no marketing costs. It's all done with their internal database of patients. So any, income they generate is 100% pure profit. So it's designed for busy practices by a busy doctor. So I know how they think, how they operate. And a lot of docs want to add other services, but it's such a hassle to add it.
Because you got to add staff. Yeah, exactly.
That's why we literally make it so simple where docs why would I not do this? That's the whole impression we're getting now from doctors we actually present this to. And that's what we want. We want it very simple, just kind of a plug and play where they become a licensee.
Well, it's the perfect podcast to have you on then because it's a podcast for providers. So do you want to talk about costs a little bit? Is that something that is
well, for them to enroll right now, there's just, again, to become a licensee, it's a one-time $495 enrollment fee, but they get that $495 back on the first patient that they enroll. So it really becomes no cost to actually join. The $495 just kind of helps us kind of get all the infrastructure built out for them, et cetera. As the
onboarding. Okay.
Right. But then they get that $495 back. So it ends up costing nothing. So it's very, very simple, very affordable. And our team walks them through it. And literally all they have to do once they come on board is they send an email out once a month to their entire database, really just saying, hey, if you or someone has type 2 diabetes, we're now a licensee in the world's only patented system to reverse type 2 and get you off your meds. To learn more, click here to watch a free webinar. That's it.
So simple.
Very simple. Patient goes through, watches the webinar, they get enrolled, the doctor earns their fee, they pay us our fee to actually deliver the service to their patient. So it makes it very simple. And that's it. So it really can't be any easier. So
let's talk about those fees just to be in full transparency. So what is the cost to the patient? What does that all look like?
Yeah. So the cost of the patient averages between $4,000 and $8,000, depending on the severity. So this is a cash service.
And it's a higher end service. 4 to 7 month program. Okay.
Yeah, there's a 3-month, a 5-month, and a 7-month program.
Got it.
So basically the fees are $4,000, $6,000, $8,000.
Okay.
So think of it as a mild, moderate, or severe case of diabetes, right? That's how we customize it based on severity. And so the doctor earns an average of $1,500 every time somebody enrolls. So it's a pretty good additional revenue stream with literally us doing all the work for them. They're just kind of enrolling the patient as a licensee. And we do it all. So it's really
you guys are dealing directly with the patient on this. The doc doesn't, once he or she enrolls them in your program, he's done. He's just gonna make his $1,500 and he doesn't have to do any more work on it.
So, and again, to keep it compliant with any kind of anti-kickback laws, like when the patient enrolls, the doctor is the one that collects the money, right?
Okay.
So the average price is $6,000. So the doctor collects the $6,000.
Okay.
It would send us $4,500 of that to deliver the service to their patient, including all the supplements, coaching, training, everything. And of course, they keep that $1,500. So that's how it works.
And that's totally fair. That's totally legal, and there's nothing wrong with that because they're paying for a program.
Correct, exactly.
Okay, great. And then, are you sending reports back to the provider on the progress of the patient? Is there communication between you and the provider? What does that look like?
I mean, it's funny how right now most of the providers, they don't want us sending out reports because, again, if it's a medical physician, right, they're already going to see because we're not the ones stepping in the primary care role.
Okay.
So we're not diagnosing anybody. We're not prescribing any meds. We're not taking people off the meds.
Okay.
So we coach them through our lifestyle program. When the blood sugar starts coming down, it's their primary physician that starts weaning them off the medications. Right?
Okay.
So if it's a physician that, becomes a licensee, they're the ones that are going to be seeing the results, right? Because we tell the patient, hey, when your blood sugar gets below 105 in the morning fasting, call your doctor and say, hey, doc, my blood sugar is 105. What should I do? and the doctor will say, hey, cut your metformin in half or whatever it is, right? Cut another 10 units of insulin. So their doctor's in the loop. Now, if it's a chiropractor, a dentist, podiatrist, etc., then if they want to report, then we can send that to them as far as how their patients are doing, because they won't be the ones taking them off the meds.
Gotcha.
So kind of whatever the doctor wants, we'll provide it.
Okay.
Yeah.
And is there a communication channel, back channel through chat or WhatsApp or cell phone that the providers can reach out to you guys if they have questions?
Oh, yeah. They'll have our direct email to our support staff anytime they have any questions, for sure.
Okay, good.
Yeah.
All right.
Yeah.
Well, this is great. I'm so excited, and we'll be promoting you obviously on all our social media channels. You'll be everywhere with this podcast. Is there one message, if you want listeners that are listening this to take away about functional and integrative medicine, what would it be?
Well, that is the real deal. I mean, this is like, I've been doing it for 35 years and the results are phenomenal. And if, again, this is just another option to offer. Again, if it's a medical physician, please add it to your repertoire. And as you kind of mentioned, a lot of medical doctors, the more they do it, the more they get away from the meds and get more into the functional medicine, because they see the results are so much better. And the patients actually want that, because most patients don't want to take a bunch of meds, but they're not really given an option. And
most patients that I've heard, or what doctors tell me, is most patients, once they get to a functional or integrative medicine doctor, have been through 7 to 9 doctors on average.
Yeah.
Specialists, endocrinologists and so forth. So they're a very sick population. And by the time they get to these guys, the goal is really to let's get to the root cause. So I love that, that you shared that. And then also for any non-medical providers that might be watching, if it's a patient that has diabetes and they would like to get on your program, what is the best way for them to reach you?
Yeah, so if they want to just do directly, they just go to our website to register for one of our webinars, and it's reverseyourdiabetes.com. Very simple, reverseyourdiabetes.com. They can register for a free webinar, learn all about it, and then see if they want to sign up.
I love it. Well, thank you so much for taking the time from your busy practice to be on the show today. I feel more educated. I'm super excited to let all of my providers know about this program and, get it out there so we can help more people. Thanks again for being on the show today, Doc.
Appreciate it. Thanks.
All right.